Hello there, guys. Welcome to my brain wreck. As you all know, that I talked about my seizures, nocturnal seizures. I've not been officially diagnosed with epilepsy or anything like that, just by diagnosed with the seizure disorder. If you guys like my channel, like, subscribe, press that bell button for notifications. Make sure you click all, that way you know when I post a video each and every time. Or click down the bottom right hand corner of the screen there and click on the little guy, the skull guy there, as you can say, or the guy with the electrodes, however you want to call it. And subscribe that way. Make sure you click on all. Well, some people wonder, are nocturnal seizures and sleep disorders connected? Oh, absolutely, they are connected. Such as sleep apnea and stuff like that can contribute to seizures. Yes. And sometimes people do have CPAPs they wear, And that stands for continuous positive airway passage. So they have continual flow of air coming into them, so that helps them breathe and stuff, and also helps to keep them from snoring, because sometimes people that are snoring a lot and stuff may have a breathing problem of some type, that are not properly, or their pillow or something is not properly adjusted right, or stuff like that. From my experience, right? Because I know I do snore sometimes. I've not been diagnosed with sleep apnea yet. I did have a 1 day test. I can't remember what it was. All they found was a periodic leg movement. I moved my legs about 70 times an hour. So obviously it tells you that I'm tossing and turning and doing all kinds of stuff. But as for now, I've just been diagnosed with a seizure disorder, not epilepsy. And I've had 3 nocturnal seizures and one pseudo seizure and so forth. So nocturnal seizures and sleep disorders are interconnected. Nocturnal seizures, as we know, which occur while sleeping, they can disrupt sleep patterns and contribute to sleep disorders like insomnia. Some people do have insomnia. They just can't sleep at all. Just maybe sleep 1 hour and get up, and excessive daytime sleepiness. People have excessive daytime. They're just sleepy and groggy and. Now, conversely, disruption of sleep, such as sleep deprivation, can lower the seizure threshold and increase the likelihood of nocturnal seizures. So that's why, like myself, my doctor tells me, make sure you get plenty of rest, go follow the same pattern, go to bed at the same time, and make sure the room's nice and dark and all that stuff, to get the rest that you need, because it's possible potential for having a seizure, nocturnal seizure, because of not having enough sleep or rest. That because your brain goes crazy, your brain gets confused. Now, nocturnal seizures does disrupt sleep, can cause unusual movements or behaviors, awakenings, which can disrupt sleep and lead to poor sleep quality. Now, as for me, yes, sleep, that's one of them, definitely. All kinds of stuff. Some of the triggers could be lack of sleep is obviously a trigger. People with epilepsy, a lot of people with epilepsy, and nocturnal seizures can further exacerbate that sleep deprivation, creating a cycle of poor sleep and increased seizure frequency. Excuse me. So when you have a lack of sleep and stuff, and those people that with epilepsy, you guys know what I'm talking about. I myself, like I said, not been diagnosed with it, but those that have epilepsy or seizure disorder sometimes, you guys can relate. Your medicine makes you sleepy and groggy and tired sometimes, or can make you just wondering, am I going to be okay? Am I going to have a seizure tonight or not? You guys worry about that. I worry about that. It's anxiety, stress stuff, and sometimes that contributes to our not getting enough sleep sometimes, because we're worried. We don't know when it's a seizure because we never know. There are different types of nocturnal seizures. Some types of epilepsy, like self-limited epilepsy with central temporal spikes, which is abbreviation SELECTS, and sleep-related hypermodal epilepsy, short SHE, particularly associated with seizures during sleep. So, on the impact of the daytime function, poor sleep, nocturnal seizures can lead to excessive daytime sleepiness, difficult concentrating, and impaired cognitive functions. And just let me put this out there. This is for information purposes only. This is not for medical information or anything like that. I'm not a doctor or a professional or anything like that. My stuff is criminal background justice. That's where my expertise is. So, but I do have seizures, like, and everything, just like people with epilepsy. And like I said, there's 40 plus types of seizures and so forth. And again, we do need to get this out there more often, because it's not there's a lack of funding for epilepsy and seizure disorders out there, and it's not brought out there as much as attention it should be to the media and things like that. And get us more across. But anyways, but if you do suspect you or a loved one that you may have nocturnal seizures, it's very crucial to consult a neurologist or hepatologist or your doctor, your primary care physician also, or a sleep or a sleep specialist, for proper diagnosis and treatment. Treatment may involve medications to control seizures, improve sleeping hygiene, and addressing underlying sleep disorders. So there can be a number of things that's affecting your sleep or causing your nocturnal seizures and things like that. And we just don't know exactly what's going on with that. It does all kinds of things. You just have no idea what does things to us or anything like that. Like I said, nocturnal seizures and stuff are related to each other. Nocturnal seizures and sleep disorders, excuse me, as I was saying. It's just, it's crazy what goes on. So, as I said, nocturnal epilepsy or seizures happening while asleep can manifest with a variety of symptoms, including unusual movement, like thrashing or stiffening. Your body's like stiffening up, and sometimes you'll be sleeping, you just sound asleep, and you're all of a sudden just wake up. Something wakes you up. Sure. And sometimes we call that brain explosion, where it feels like something just pops in your head. It's not. It just sounds weird. I know. It's hard to explain how it feels, but for these guys that have epilepsy or seizure disorders, you know what that is or whatever. It's just some type of weird sensation, like a firework going off in your head, like big bang. And you're like, you wake up and you ask, did you guys hear that? Or you're sniffing to go there or whatever. Did you hear that explosion? No, that was the explosion in your head. They call brain explosions. I'll get into that in a little bit later on. And sudden awakenings, like I said, from brain explosion, and sometimes loss of bladder control or tongue biting, and bite our tongues and stuff. Other symptoms include shouting, screaming, and unusual sounds during sleep, as well as being difficult to wake up afterward and feeling confused or drowsy. So, yeah, we do feel confused or drowsy sometimes. As I mentioned about leg movements and stuff, that can be associated with periodic leg movement or sleep apnea. Sometimes people even people that have neuropathy. I'm sure some of you guys that have seizure disorders or epilepsy may have some type of underlying cause, or maybe not some cause, but have some type of other medical condition such as neuropathy, where your nerves and stuff, it can be painful stuff or annoying stuff. Violent arm or leg movements, thrashing around in bed, or suddenly stiffening. You just stiffen up like this. You wake up for no apparent reason, often multiple times a night. I myself do wake up quite a few times a night, actually. I'm not sure why it happens or what's going on. And as I mentioned, loss of bladder control, because our muscles, we have no control what's going to happen, why, whatever. Like if somebody's having a seizure, you just don't know what's happening or going on. We have no control over our body at the time. Other sounds, shouting, screaming, or other usual noises, People make some funny noises. As, it's hard to say. Post-seizure confusion, that's after a seizure. Difficulty waking up, feeling confused, and appearing drowsy the following day. Sensory disturbance, our sensors and eyes, nose, mouth, taste, start smelling stuff, seeing things, hearing things, changes in vision, unusual smells, or numbness or tingling. Now, some people that have the unusual smells stuff, they smell like electrical burning or something like that, or something else, electrical or stove or something that's been on, or oven. Involuntary movements, jerking, twitching, or other involuntary movements of the limbs, etc. Now, like I said, this is for information only. I'm not a doctor or anything like that. My background's in criminal justice. All right. So, the reason I'm doing this is just to get information out. This is not for medical information or anything like that. I'm just passing along stuff from what I'm learning and reading. So an important note here, nocturnal seizures can be difficult to recognize as they occur during sleep and may be mistaken for sleep disorders or other issues. As I said, sleep disorder, sleep apnea or sleep disorder or anything like that. If you if you suspect or if you suspect you or someone experienced nocturnal seizure, make sure you consult with a medical professional for diagnosis and treatment. You want to make sure you absolutely do that because you don't want to go on with that type of stuff. It's not good to do. So always make sure. And as I mentioned, there are different types of seizures, all kinds of stuff. There's, like I said, over 40 plus different types of seizures. There's quite a few of them. So I'm just going to say a little bit more here, and so I'm going to talk about the seizures here. People that have seizure disorders or epilepsy or other times, Dravet syndrome and stuff like that, and we'll get more to that. And I know a lot of people say some people try to do a ketogenic diet for seizures, also one for children. There's also the vagus nerve stimulator. It helps lower the threshold and stuff, but I'll get more into that later on in some other of my videos and stuff to show you about my brain wreck. That's why I call this my brain wreck, obviously. My brain wreck. It took a wreck. As I call it, as some of you guys know, it took a wreck. So I'm just going to read over here. And this is from hopkinsmedicine.org, all right? You guys know the hospital, John Hopkins, whatever. So seizure symptoms vary and can include a sudden change in awareness or full loss of consciousness, unusual sensations or thoughts, voluntary twitching or stiffness in the body, or severe stiffening in the limb, shaking with loss of consciousness, a convulsion, basically. There are two major classes or groups of seizures: focal onset and generalized onset. Okay? So focal onset start in one area and can spread across the brain and cause mild severe symptoms depending on how the electrical discharge spread. So your brain is getting confused. You're spreading electrical discharge. It's not communicating in the right way, so it confuses your body. Generalized seizures can start as focal seizures that spread to both sides of the brain. So here and here. That's pretty scary, right? They also can occur as generalized onset seizures in which seizure activity starts simultaneously over both sides of the brain. Generalized onset seizures usually start during childhood, which myself, I have never been diagnosed with any seizures, this or that, and I don't know any family history in my side of my mom's or dad's side if there's anybody who's been diagnosed with epilepsy or seizures or any type. Not that I know of, anyways. I'd really have to do some research on that, but unfortunately, a lot of my my grandparents passed away when I was a lot younger, but they're also much older grandparents too. When I was born, they were older grandparents, already up there in age. So generalized seizures can start as focal seizures that spread to both sides of the brain. They also can occur as generalized onset seizures, in which seizure activity starts simultaneously over both sides of the brain. Generalized onset seizures usually start during childhood and are similar to a thermostat surge or a light flash. So thermostat, like goes up. And normal regulation between parts of the brain causes the seizures. So it's abnormal regulation, something's not controlling stuff. So seizures of all kinds are most commonly treated with medication, as we all know. Now, not all medication is going to work for your seizures at all. That's why some patients and stuff, they get the VNS in here, or they get I think it's called the RNS. Please forgive me because I'm not quite sure, but that's what they do. So seizures of all kinds are most commonly treated with medication, and if they are difficult to control, with diet therapy, nerve stimulation, or surgery. So people do have surgery and stuff. Sometimes they have parts of their brain taken out and things like that. It's scary, but it's very scary. So, and as I said, nocturnal seizures can be controlled with anticonvulsant medications. I'm on 2 of them, so on the maximum dose of 1 of them, things like that. So, and a lot of people, suggest do an overnight sleep study, even with your children, even for adults. Overnight sleep study, or a 72-hour one. Some do longer. So Now, a sleep study, people along with nocturnal epilepsy, if they have it. Now, it's very hard for doctors to diagnose and figure it out sometimes because they're not going to catch that all the time. So the stages of sleep range right from light to deep. Each stage has a characteristic that can be measured, right? So like our non-rapid eye movement, our REM, our first stage, second, and third. I believe it's our 3 or 4 stages. So the stages of sleep range from light to deep. Each stage has characteristics. Excuse me, I'm reading more here from Hopkins that can be measured. A sleep study is a number of tests done at the same time during sleep. The tests measure specific sleep characteristics and to help diagnose sleep disorders. As I mentioned, there is a connection. It's connected somehow. You know, you have seizures and stuff, and you're waking up, and you're not sure why you're here, what happened, what's going on. A sleep study may also be called a polysomnogram. Okay, so the basic recordings done during sleep may include the EEG, which stands for electroencephalography. Please forgive me, I'm trying to pronounce this right. Electroencephalography, or graphy, or whatever. This measures the brain wave activity. So now sometimes that's not going to catch your seizures or anything going around, even if they try it. Sometimes they do sleep. Sometimes they will do a sleep deprived EEG and stuff, for you gotta stay awake for 24 hours, and then they'll do that, or they'll do a video monitoring at home and stuff like that, which can be embarrassing, obviously, because they're watching you sleep and do everything with it. They do EOG, electrokilogram, not kilogram, electrokilogram. All right, EOG. This measures your eye movement. So what it's doing is measuring eyes, if it's moving certain ways or not normal patterns. It might make normal patterns move something totally weird. Or they do so sometimes they also do these bright lights. You close your eyes and it flashes into your face, and they're trying to induce a seizure sometimes, or see how your eyes are moving, and you can't see that light come through. I've had it done, but it didn't do nothing to me, but I could see the lights coming through. So that measures eye movement, EOG, electrooculogram. Oh, there you go. Now I said it right. And then you have EMG, electromyography. This measures muscle movement. So you got stuff here, and all that good stuff. And then you got the ECG, an electrocardiogram, obviously, checking everything on your heart. It's used to record electrical activity of the heart. The recording may also be made of you while you sleep. So sleep studies generally take place in a sleep lab, which I did go to a sleep lab, but it's just one day, which I don't think was enough personally, in my opinion. They didn't see nothing. All they seen was my periodic leg movement. I moved my legs so many times within an hour, each hour or whatever. The goal is to record brain and body activity that happens during sleep, so the sleep disorders can be diagnosed and treated. So that's how they figure out and treat you. All right, now during the sleep study, the following may be measured. Eye movement, the number of eye movements and their frequency or speed. How fast your eyes are moving back and forth, up and down. I don't know if you guys see me move my eyes back and forth and up and down or whatever. And the brain activity, electrical currents of the brain. So wave patterns, and the wave patterns are going across and stuff. And they already have a set graph in place and stuff, and they can know if it's normal and stuff, right? I mean, that's what they're trained for, right? If it looks different from the normal graph of people on the average brain wave, then they'll recognize something. As for the limb movement, the number and intensity of movements. So my limb movements, obviously my legs or the limbs, right? And like I said, I moved my legs about 70 times within an hour, so it's quite a bit. It tells me that I'm doing something, I don't know why, what's happening, what's going on. Breathing patterns, the number and depth of respirations that can be affected. So that can be associated with sleep apnea. People having trouble breathing or whatever, or laying down. But it could be a positioning, like I said, it could be a positioning how they're laying, or they're not comfortable enough, or hence how CPR, they tell you when you do CPR, make sure you put the neck back, whatever, the head back and stuff, and that way the airway is opening up and you can get airway while you're doing chest compressions. Nowadays it's more, you don't usually give them a mouth to mouth. Usually nowadays just the chest compressions that save their lives. Heart rhythm, electric activity of the heart, electric cardio, EKG, whatever, check that. Now, the percentage of oxygen in the blood, and look at that, how it's going, how, is it too high, too low? And this one is very interesting. I didn't realize I had this, but acid-base balance of the stomach, the amount of acid secreted during sleep. So I'm not quite sure how they measure that, but I guess they do measure that. And then they got the sleep latency, the time it takes to fall asleep. Now for me, my gosh, I'm not sure how long it takes me to fall asleep, but I think it takes a while for me to fall asleep. But once I do, I'll wake right back up with it. If I hear like maybe the slightest noise or something, just I hear something, I don't know why. Sleep duration, the period of time a person stays asleep, obviously. Now, for people that have seizure disorders or nocturnal epilepsy, nocturnal seizures or epilepsy or any type of seizures, I believe that they want you to get a good rest for at least 7 to 8 hours, as from what I'm understanding. Now, of course, the sleep efficiency, the ratio of the total time lapse or time asleep to the total time in bed. How well are you sleeping? How efficient is it? Then for me, as my efficiency, I'm gonna feel tired and groggy if I'm waking up. Like I said, I'm waking up and stuff. And people wonder why I feel tired and groggy. Well, I'm on very strong medicines for one, and two, I'm always waking up for something or other reason. I'm not sure why. So, in addition, these tests may be done. All right. So, multiple sleep latency tests (MSLT), which measure how long it takes to fall asleep. Then multiple wake tests measure whether you can stay awake during specified times. Obviously, if like you guys are in a hospital, you maybe been admitted to a hospital, the doctors or nurses or techs will come and wake you up because they come wake you up because they gotta check your blood or whatever, your blood pressure and stuff. That can be annoying, so that can be contribute to a little bit, I suppose. Now, doctors that are trained in sleep medicine evaluate test results to treat sleep issues. Obviously, a trained sleep technician will be with you in the sleep lab during the testing period. So basically, if you've ever been in there, usually they're like behind a window and stuff, and you're in bed, whatever. And they're watching you and seeing. So now, why do you think you might need a sleep? Why might you need a sleep study? Well, common reasons for sleep study include excessive snoring, as I mentioned, sleep apnea, where you start breathing. I guess I've had stopped breathing a couple times. Obviously, with my nocturnal seizures, I did stop breathing all 3 times, and my wife had to do CPR each time. And as I said in my last videos or my other videos, that my last one I was put into a coma because I was not responding to anything. But thank to God upstairs and the doctors and my wife, I'm here today. The EMTs and stuff. Oh, what else might need a sleep study? Insomnia, the inability to sleep. I'm sure there's quite a few of you that have epilepsy that have trouble falling asleep. I'm not totally understand how epilepsy works or what's the cognition of it, or but I'm learning a little bit here and by from here and there. But like I said, I do have a neurologist appointment come here on the 23rd, so hopefully maybe he can give me a better diagnosis of stuff and understanding what I need to do. Narcolepsy. I mentioned one of those videos. Sudden onset of sleep, where you just fall asleep all of a sudden, and then you can be standing up and fall asleep with narcolepsy, I believe, and then you wake up like, oh. Now, I'm not mistaken. People that have narcolepsy are not allowed to drive at all. So, if I'm mistaken, I could be wrong. I don't know. I guess it just depends on the state. Restless leg syndrome, as I mentioned, conditioning causing uncomfortable leg sensations. This feels like a buzzing feel on your legs, feet, anything like that. And then next, you got their nightmares during non-dream stages of sleep, sleep terrors, sleepwalking, or talking, rapid eye movement disorders, or those common conditions that may also require a sleep study. So you have night terrors. Those can be scary and stuff. You're not sure what's going on, or you're just waking up. You could be waking up from a dream that's scary, or something like that. So there are all kinds of different things. Why is the rest for a sleep study? There's no known rest for sleep study other than possible skin irritation due to the attachment of electrodes to the skin, obviously. So, and then of course, if you're getting ready for a sleep study, if you guys are wondering, for those, whatever, this is, like I said, this is information I'm providing you. I'm not a medical personnel or anything like that. I'm just providing you information from Johns Hopkins here. Your healthcare provider will explain the procedure and you can ask questions. So you may be asked to limit your sleep before the study, avoiding naps, for example. And then, of course, you got to tell all your medicine you're taking, prescription over the counters, and herbal supplements that you're taking. They may alter test results. So they may not have you take something or whatever. Definitely avoid caffeine containing products for several days before the test, as they may cause you to take longer to fall asleep. They want to see you on your normal, behavior. Yeah, your normal behavior when you're falling asleep. So don't take any caffeine several days before you're gonna do your test. Unless directed by your healthcare provider, sedatives are usually not allowed. So anything that's a muscle relaxer or anything like that, obviously you can't take that during a sleep study, as they can alter results. Now, a sleep questionnaire or diary may be given to you and your bed partner, if applicable, to fill out ahead of time. Do your best to give true responses. Always be true responses. Just be honest. Otherwise, they're really not going to know about you, but help you the right way. So now, showering before going to the sleep lab may be helpful, but avoid using lotion or oil on your skin because electrodes may not stick to the skin. That's why I don't do that. And maybe yours bring your own pajamas and pillow. So me, when I went for my 1 day sleep study, I just took my just wore pajamas or whatever, sweatpants and a loose T-shirt. Now, if you need, you may be able to shower and dress for work the morning after the sleep study, if need be. Now, based on your condition, your health care may ask for other preparations. All right. So, other than that, not much to do. So, what happens after your sleep study? You won't need any special care after a sleep study. Results may take several days. However, your healthcare provider may give you other instruction after the procedure based on your situation. So, as I said, nocturnal seizures and sleep apnea obviously can be related. More than likely, they're definitely interconnected. So, just do your best you can. And as I said, hopefully this helps you guys some. I know it's not the greatest video here, but I know these are video longs because there's so many videos I can do on seizures and stuff like that, which I am going to do. And I just want to get the information about seizure disorders and about people like myself and you with epilepsy or seizure disorders of any type. I want people to understand us, that we're just a human being like everybody else, and we deserve the same treatment as everybody else, and be kind and humble and carry it forward. And we want to be loved just like everybody else. And that's why I thank God my wife is loving and caring for me. And she is always watching me constantly because she worries about me. And I know she does. So I appreciate that about her. So to all you purple warriors out there, you guys stay strong. All right. This is my brain wreck. You guys have a great day.